This is Nursing School Chronicles, Episode 5. My name is Briley Sweeten. I'm a senior nursing student.
My name is Sarah Ramos. I'm a senior nursing student.
My name is Rachel Ategu. I'm a senior nursing student.
My name is Jenna Spencer, also a senior nursing student.
So today we're going to start talking about our nursing journey. It's coming to an end. My name is Briley. I chose nursing because I like the sense of caring for everyone, and I feel like I am a server in that way. One moment that shaped my journey, I don't think I have a single moment. I think it's just a lot about talking to the patients and just getting to know them personally, each patient. Not really a single journey or a moment or a single patient.
It's a good one, Briley. My name is Sarah. I think, it's kind of a funny story why I chose nursing. When I was younger, my sister was always like, my oldest sister, she'd tell me, like, be a nurse, be a nurse, be a nurse. And it would make me mad because I'd be like, no, because the reason she was telling me to be a nurse was because I had big hands. So she told me to be like a L&D mother-baby nurse. And I was like, But then as I got older, I was like, yeah, I do want to be a nurse. Like, that's a good idea. I do like helping people. Like, that's cool. So here we are, all these years later. I think for me, I don't think there was like anything. Well, I guess, the first big trauma that I saw and I was in the room for, I don't think that was exactly the moment that shaped it, but I kind of realized the gravity of what we do as it was a huge trauma. We see this person laying there and all these nurses and doctors and everything, they're like floating around the room, and I'm like watching it and I'm like, wow, like they're
vulnerable.
They're vulnerable, and then these nurses are just like little angels floating around the room right now, like working so hard to save this person. So I think the gravity of what we do really stuck with me in that moment.
Yeah.
I'm Rachel. So the reason I chose nursing, most importantly, is to save lives. Like, funny enough, like I'll watch movies of maybe someone dying and I'm going to just jump into the movie. I'm like, can I save them? But like, I really want to save people. Like anything to make people happy, anything to improve people's life, I want to be that person. So that's why I chose nursing. And then not really one moment, but the moments that have shaped my life is like clinical experience, like meeting patients that appreciate like everything you do for them, like the preceptors, my professors, like they really shaped my nursing journey. Like the encouragement is a huge one for me.
I'm Jenna, and I chose nursing because I always wanted to help people when they need it most, when they're at their most vulnerable state, and just to be an advocate for the patients whenever they can't speak up for themselves. I want to be the one to do that. I don't think there was like one big moment that shaped my journey, but I think it was like a lot of little moments. Whenever I was a tech in the summer, I would have a lot of patients tell me like, oh, you're going to be such a great nurse. And they would always tell me that. So I think that really like
gives you comfort.
Yeah.
It's always like a moment.
Yeah, I hope so. Yeah. So a theme or focus area that we're each going to talk about, I chose what specialty I'm the most passionate about. So the specialty that I'm most passionate about is peds oncology. I want to help the children that have cancer and they're just little fighters, and I feel like I want to help that. I want to be a part of their little steps and their little journeys.
Yeah.
Mm-hmm. I picked resilience in nursing. I think because we're in such a insane environment. I don't know a better way to put it, but we're in such an insane environment, and like we work the hours we work, we see what we see. I think that there's a lot of burnout that comes with that. Mm-hmm. But you see these nurses come to work day in, day out, and they're just, like I said earlier, like little angels. They're just working to save you, to help you, to be there. And I don't know, it's just really awesome to see, and it's important to me. And I just hope I can kind of convey that as we enter the nursing world.
Mm-hmm.
So, I used to have only one specialty that I was passionate about, which is psych. I'm still passionate about psych because I feel like there are few psych nurses around. And I want to be able to help people that need help feel like mental illness. Like I want to be there to be like, hey, your feelings are validated and I'm here to help. And also I started looking at the nursing home. Long time ago, I used to work as a caregiver for like elderly people with dementia. And I just really loved it because like looking at the elderly people, I'm just like, I know one day I'm going to be old. So I got to pour in my heart and help those people so that way when I get old, I have somebody pouring their heart to help me too. And then the hospital, I like med-surg because med-surg, I see a lot of things and I learn more in med-surg because med-surg, you just see varieties of like different clinical experience. So yeah, those 3 specialties I love right now.
I chose advocacy and patient-centered care. I feel like as nurses, we should always be trying to give the best patient care to everyone, and treating everyone fairly. And a big part of our job is to advocate for patients. So I think that's really important for us to do.
So a personal story or reflection that we can all share. I think a personal experience would be just with the nurses, and especially like in the ER with Nurse Tina. She just helps you so much, and to me, I feel so vulnerable as well, just like the patient, whenever you're doing an IV or giving meds or even giving like education as a nursing student, because you don't want to mess up. And you don't want to like cause any harm to the patient or to act stupid. I mean, you don't want to look dumb. So I think that is a moment of growth in those moments, because once you accomplish that, you just feel so much better about yourself and you're like, oh, I did it. Now I can do it again.
I think, nursing school in general has been challenging. Like, we can all say that. Of course, we have great professors and everything, but it's been a challenge. And I think looking back, we've seen ourselves grow so much. I know I have. And I think, like, a personal story is, I want to say it was our second clinical ever junior year. And I don't know, I had a patient that was a little bit more difficult for me I was still learning, so at that moment I didn't know how to properly act, and so it was a little rough for me that day. And I went to the bathroom in the med-surg staff lounge and I was crying. And somebody was in there and I was so scared to come out. I popped my head out and it's Jenna, and I was like, I was just crying in the bathroom.
I do remember that.
But so like, I think after that, like, that was probably one of the most challenging clinicals because it was hard, and I didn't know if I was going to be a good nurse. But after that, I was like, no, hard days are going to happen, and here we are.
Well, my patient experience, I want to share like a moment of growth. Like looking back from the first semester of nursing school, I remember like nurses like testing your knowledge, especially on medication. Like they want to know, like, do you know what you're giving the patient? And I remember my first semester in nursing school, before we get to the patient's room, my nurse would like to test me. I'm like, I don't know. So it got too much like, I don't know. And I'm like, I feel bad. But she's like, take your time. It takes time for you to learn this medication because there are a lot. But now, looking right now, I'm like, most of the medication I could identify, and I'm like, okay, I know this. So comparing like, I don't know to like, I know this. So it's like a moment of growth for me. So I'm getting there. I'm getting better.
Yeah, that's good.
I think for me, it was our first clinical ever. I can remember I was so nervous. I literally did not even want to go into any patient's rooms. I didn't want to look at any labs. I didn't want to do anything. I was just always thinking to myself, like, what am I doing? Like, I don't think I can do this for a living. But now that I look how I'm doing now, when I go to clinicals, I feel a lot more confident, and I can go and actually talk to patients. I can put my skills to use. So it's a big moment of growth for me.
So crazy.
Yeah.
Yeah, lessons learned. I mean, there's so many lessons learned, like, about myself that I've learned that, you could push through so much. There's so much mental struggles that we have all endured, and you just learn that you're stronger than you think you are, and you're smarter than you think you are. And the instructors and patients, like, they can either be harsh or they can even be better, and it's even harder when you do have a I guess, a meaner nurse. Like, that's even more of a challenge for you because you're already vulnerable in the clinical setting, and then they're just, asking you questions or being rude. But that's also something that you learn because you're not going to treat a nursing student that way whenever you're precepting.
Yeah.
And I want my future patients to know that, like, I'm going to put my all into your care, and I'm going to treat you as if it was my dad or my mom or grandpa, grandma, whatever, my family member out there. So I want to make sure that they know that I'm going to care for them in the best possible way.
Mm-hmm. I think for me, what I learned about myself is, and it sounds so cliche, but I can do hard things.
Mm-hmm.
And because this genuinely has been, in a good way, so hard.
Yeah.
And it's tested me mentally, emotionally. Like, there were some days that I would just like, I can just cry because it's like, what are you doing? This is so hard. But the payoff is so rewarding. And I'm so excited to graduate and like really enter the nursing world because I know it's just going to be hard and good. And like, it's just going to be a mix of everything. And I'm so excited for that. And I think that for me, my patients and instructors have just like taught me genuinely just how to be good and sweet to people. And because you come across patients that they're not always sweet to you, and you're like, when I'm older, I'm not going to act like that to my nurses. And then you meet some sweet little angels that you're like, goodness, I want to do everything to be so sweet to you and just be the kind of nurse that you deserve. And so I just hope that my future patients will know that I will always try to be the best kind of nurse and be the nurse that they deserve and be someone that they can count on in their darkest of times.
Yeah.
One thing I learned about myself is I think I can do more than what I think I can do. Looking back from my nursing journey, transferring, past in my old school, things broke me. But look at me today, I never gave up. Like, I'm going to graduate May 9th. So, like, I feel like I learned that I have a high level of determination because the things that happened to me would have broken me and then would have probably made me like feel discouraged. Like, I don't want to do nursing, but I'm like, no, I'm going to do this. I'm going to finish. And look at me right now. So I learned. And then my patients, what they taught me is that your patients actually see you. What I mean is they see what you do for them. They know when you genuinely care for them. They see you and they let you know like, hey, you're doing great. I appreciate everything you're doing. So like, just keep doing what you're doing. Keep doing good to people. Keep doing right to people. So, and my instructors, they taught me that you could do more than what you think you can do. Like Dr. Gonzalez, Dr. Redondo, they're always there to encourage you. Even if you're having a bad day, they're like, yeah, you're going to finish strong. You're going to be a great nurse. Even my nurses at the hospital too. So they taught me that. And then I want my future patients to know that they could trust me with their lives. Like, I'm not there to play with your life. I'm there to put in my A game, my 100%, and then make you feel better. And then you can also see me as a friend, not just like a nurse, but you could see me as a friend, someone you could trust with anything. So,
I think I've learned that I'm so much stronger than I think that I am. I remember that like when people would ask me what my major is, I would always tell them, oh, nursing, but I think I'm going to switch. Like, I don't think I'm going to do this.
yes.
But I mean, here I am, I'm going to graduate. And it was so hard, but like, I don't know, I was strong enough to push through, and I'm really proud of that. And for my future patients, I feel like what Rachel said, like, I'm not there to play with your life. Like, I'm going to do my best. I'm going to do everything that I can, like, to help you and just get you out of the hospital.
Okay, so looking ahead, so, like, what kind of nurses we all want to be? So the kind of nurse I want to be is I am going to be an OR nurse at first right now, but I do have goals, like I said, to do pediatric oncology, or I even long-term goal, I would like to be a nurse practitioner. So there's many goals for myself and many specialties that I would really like to get into and at least get a little bit of knowledge before I'm a nurse practitioner. Mm-hmm. And I want to make an impact that way because I want to like better your life and just help people. I mean, I want to serve. and it also scares me. I'm very excited. I'm very excited to graduate, but I am very scared because I don't want to mess up and I want to do my best.
Yes. Well, what kind of nurse do I want to be? Right now, I'm going to be an ER nurse. So that's exciting to me. It's kind of scary. I think I go back and forth with like, well, I might want to be a flight nurse. Might want to be an NP. I might want to do that, but who knows for right now? That's in the years to come. But for right now, I'm sticking to the ER, and I just kind of want to be the kind of nurse that I would see at clinicals and think like, oh my gosh, I want to be them. They are so good at their jobs. Like, I have a few words for it, but I can't say them on the podcast. But they're just so cool. I want to be them, and I just hope that I can be that for them and make an impact in the way that it's like, hey, one time I went to the ER and we had a really cool, good nurse, and like I trust her with my life, and you should go there because she's pretty safe. So yeah, I hope for that too, and that's what's so exciting about the future to me.
Right now, I'm going to be a nurse at the nursing home and also a nurse at the med-surg floor. And my long-term goal is to be a psych nurse. I'm going to retire as a psych nurse. I'm working hard to do that. Like Bridie said, I'm going to do my NP, like to better my education, better my skills so I could help people that have battling with mental illness. And then I want to make this impact by, first of all, showing up to work with my A game. You know, making sure that my patients are doing okay and I'm doing what is right and making sure I'm saving lives. And the thing that excites me the most about the future is meeting my future patient, because I want them to be happy when they see me. You know, I want to be that nurse that just seeing me, you're already happy. Even before I bring your meds, you're like, you're already happy. You're already feeling better before your meds.
Right now, I keep going back and forth between the ER and L&D. During clinicals, I loved both of those units so much, and it's really hard for me to choose one because I really want to do both. So either one of those units I would be very happy to be in. I'm very excited about being a nurse. I don't know, it's just like we're gonna really be helping people in such a big way. It's scary, but at the same time, it's like, wow, like you're really making a big difference in these people's lives.
Okay, and lastly, we're just going to leave y'all with a little message to the future nursing students and even each all of us. And to future nursing students, just keep pushing through. Look at the positive. Don't look at the negative. It's going to be hard, but you can do it. You're there for a reason. To the faculty, thank you so much. I mean, there's so many words that you could say that we're blessed to be put in this position. And to your cohort, I am so blessed to be with you guys. I mean, we all endured the same things, and, you know, times were rough, and we all understood each other. And I want to keep up with each and every one of you, and I want to know how you guys are doing, because y'all are all going to be amazing nurses.
I think to future nursing students, we have talked a lot in this podcast specifically about how hard it's been, but don't let that scare you. Like, it's going to be hard, but we all just said we could do it. We did it, and you can do it too, and you can do hard things. And I think Rachel said at one time, like, this wouldn't have been placed in your heart if there weren't a reason and if you couldn't do it. So you can do it. And to the faculty, I just want to say thank you too. Like, if it weren't for y'all, I don't know where I would be. I don't know who I would be. I strive to be the kind of person that you all are, and I hope that if I can even be half of who y'all are, it's good enough. And so, yeah, thank you to them and to the cohort. Thank y'all. I love y'all so much. And I feel like we have become such a close little unit. And like, I know there's times we want to pull out each other's hair. I just know it. But I love y'all so much. And I do hope we can keep up with each other and I get to see what y'all do, because I know y'all are going to do amazing things. And I'm excited for y'all.
To the future nursing student, there's going to be a little bit of anxiety in nursing school. I'm not going to even lie to you, but like, do not let the anxiety and the fear take over you, because fear is going to steal your joy. Fear is going to steal your success. So don't let that take over your determination. And to the faculty, I just want to say Thank you. Because like the patience you guys had for us, like it has brought us this far. And thank you for putting us first in everything. And to my cohort, I love you guys. You guys are amazing. Like I'm just imagining like all of us going for vacation. Now like probably you don't have the money. But I just imagine like we go out and then we don't even look at prizes. We just pay. I'm really hoping for that right now. So yes.
For future nursing students, it's gonna be so hard, but it's so worth it. Like nursing is such a rewarding career that when you become a nurse, you'll look back and it's like, who cares that I was stressed? Like I'm doing so amazing right now. To our faculty, y'all are the best. I know we were not an easy cohort. We're just crybabies all the time. Yes, we are spoiled. But y'all were so amazing to us in everything. Y'all are just the best. And to our cohort, I love y'all so much. I can't imagine going through nursing school with anyone else. Yeah, I know y'all are going to be such amazing nurses, and I can't wait to see what y'all do.
Thank you guys for watching.
Thank you.
Brandon.